Hi, my name is Erica Robinson, and this is my PowerPoint presentation. The topic that I have is the effects of incorporating full body movement with learning high frequency words on students with multiple disabilities. So the area of focus that I will be focusing my literature review on is high frequency word retention and what strategies best support students with multiple disabilities. This is something I'm interested in because I am a special ed teacher, and just seeing how high frequency words are so important for students to retain to help with their reading. So, the significance of this study will add to the growing body of research about high frequency words. This study will be helpful for teachers, principals, curriculum specialists, those in educational leadership. This research will be useful because it will allow educators to gain a deeper understanding of how students with special needs can retain more when they engage body movement into learning. And so with special needs, what I have noticed is when you have multiple sensory incorporated into the learning, students are more engaged and can retain more information. And so for my research question, I actually have two here. So my main focus is, what is the effect of incorporating full body movement in learning high frequency words on students with multiple disabilities? And my secondary question is, what are the best strategies to support high frequency word retention with students with special needs? Because as we know, there are multiple strategies to use when teaching students high frequency words. And for instance, we have flashcards, we have that repetition with flashcards. But I would like to see how, when we incorporate them moving their body, if that will improve the learning of high frequency words. So for my literature review, I will begin with the history of the development of high frequency words. So the Dolch word list was created by Edward William Dolch in 1936, and it was first published in Problems in Reading in 1948. So he really laid the base of high frequency words and the importance of it. And then Dr. Edward Fry developed this expanding list in the 1950s, and it's been updated in the 1980s. And based on the most common words appearing in reading materials used in grades 3 to 9, so that's the part where they updated it. But so the high frequency words are extremely important because these are words that they will see the most in reading. So Ayer explained that there are 4 stages of student sight word development. And so the first one is pre-alphabetic, the second one is partial alphabetic, and the third full alphabetic, and the fourth consolidated alphabetic. And so this is he did research and found out that there are 4 identifiable stages that students go through when they are learning these high frequency words. So sight words are also known as high frequency words, and they're a vital part of reading fundamentals, and students with learning disabilities especially need sight word mastery to become fluent readers, and that's by Donnell and Lambourne. And then another information that I had looked at was how special education students, how they process this information. And for special education student, it allows them to free up the cognitive resources so they can focus on the tougher words that require strong decoding skills. And so this would be under the special needs students and sight words section in my literature review. So some of the studies and strategies that I found in some articles, the first study is reading racetracks, which is really, it's been really focused on within the educational community. And so it's research based, and it has its activities on using sight word instruction. And then the next one, when implementing effective reading instruction, only a small set of words need to be taught as sight words. Reading most words should be an effortless act. So when introducing these sight words to students, we don't need to give them the full 25 list for kinder or TK. Just introducing them 2 at a time, 3 at a time, instead of giving them this big list just to memorize. So my methodology. So the type of study I will be doing is descriptive study utilizing a mixed method. So my subjects are going to be my self-contained special education classroom. And I am also, I'm a special ed teacher, and we are the most restrictive environment for students who have extreme behaviors. So most of them are emotionally disturbed. They've been diagnosed and they have multiple disabilities. So some are autistic, some have a delay. And so I have a total of 6 students. 1 is a female, 3rd grade, and 5 are males. 1 first grader, 2 second graders, and 2 third graders that are males. So each student in my class does have multiple disabilities. So the way I will be collecting data, my first way will be the benchmark assessment system, which these students have taken the assessment this school year already. This will be the second time of this school year. And with that, it measures how many sight words they know and what reading level they are. So it'll be their instructional reading level and then their independent reading level. And then the next way that I will be collecting data is a high frequency recognition test that I have made myself, where I have sight words that are Velcroed to the floor, where students will hop on them and say the word. And as they are doing that, I check it off. So it is incorporating their full body. So jumping, hopping, walking on the words. And I will collect data that way as well. So continuing with the methodology, the analysis of data that I will have are the 2 different testing systems. So with the BAS and then my own test that I've created. Then with the ethical considerations, so the bodily risk, just because it is a full body movement that the students will be doing. And for privacy issues, because each of my students are on an IEP. So just having that privacy part as well. So limitations of the study, sample size from my 1 classroom. It's only 1 classroom and it's just from my school. And then the male to female ratio is quite a bit big. And so that is the end of my presentation. Thank you very much.